Hi everybody, in this video we're going to demonstrate a very commonly used technique known as the dog adjustment. It's also an AP thrust with the patient in a supine or face-up position on the plinth. When we show or demonstrate this, we're going to show the three separate techniques. So we're going to show the technique that's commonly used for T1 to 4, then the next 4 following vertebrae for the mid-thoracics, and the last 4 vertebrae using the cradle hold adjustment for the lower thoracics themselves. We have 3 different vectors of push. We have a superior push for the upper thoracics, and the following 2 will be a more direct AP push towards the table. So to demonstrate the manipulation or HVLA thrust for the upper thoracics, T1 to T4, we have 2 separate techniques we can use for the upper thoracics. So when we have a patient who has or is slightly more hypermobile, we can place a towel across the upper thoracics, ask them to give themselves a hug around, and this gives us a little bit more purchase across the thoracic region. If the person was more barrel chested, they may be able to do the hold and their chest cavity will fill the space underneath their elbows. But in this case, we're going to use the towel as a fulcrum. So we have a couple of options. So from here, we use the arms to roll the patient. We use the pads of our index fingers to palpate across to the spinous process, looking for T1 and counting down as far as T4. Now we have to make sure we're safe here, that we don't use the angle of the rib. This would be dangerous. We have to make sure that our SPs are on, our pads of our fingers are on the spinous process or SPs themselves. To find the segment, we can simply just passively motion the patient left to right and find the restricted segment. We then lock our hand around the SP to ensure that we're on the spine itself. We then roll the patient directly over our hand. We pull our elbow in, making sure that we're looking up the table with our chest up. Once we have the elbow pulled in, we can rotate to find the restrictive barrier. In this case, it's on the patient's right. We can find the side shift, which is on the patient's right, and then we can add either segmental flexion and or extension. In this case, it's flexion. Once we have those collected, we can compress and thrust in an upwards of 45 degree towards the patient's head. Now what we can also do here is just use a U shape, elbow in and full stop with a push at a 45. And an alternative technique here would be asking the patient to bridge their hips up. So if you bend your knees, and from here, bridge your hips up in a glute bridge fashion, and the moment the pressure hits your hand, we drive at a 45 degree towards the patient's head. So we're just going to go through with that technique. So from here, we're going to use the glute bridge technique. So I'm going to lock my elbow in, I'm going to come around in a U and just bridge your hips up for me. And the second we feel the pressure up, thrust down towards at a 45 degree towards the patient's head. And there we have it, guys, a nice simple upper thoracic AP thrust in the dog position.